Look them in the eyes and tell them you're doing all you can to stop the spread of COVID-19.
The faces of those on the COVID frontline are part of a sobering new public health campaign from a government desperate to keep people following the rules. And this is why.
I must tell you this afternoon that we've been informed today that in addition to spreading more quickly, it also now appears that there is some evidence that the new variant, the variant that was first identified in London and the South East, may be associated with a higher degree of mortality.
The news that no one wanted to hear, that the latest evidence from the government's scientific advisors is that the new variant is more deadly, and this is what it means.
If you took somebody in their 60s, a man in their 60s, the average risk is that for 1,000 people who got infected, roughly 10 would be expected to unfortunately die with the virus. With the new variant, for 1,000 people infected, roughly 13 or 14 people might be expected to die.
That's a 30 to 40% increase in mortality, but amid the gloom, a glimmer of light.
All current evidence continues to show that both the vaccines we're currently using remain effective both against the old variant and this new variant. And so you'll also want to know that our immunisation programme continues at an unprecedented rate. 5.4 million people across the UK have now received their first dose of the vaccine.
And even more good news with the all-important R rate down and hospital admissions levelling out. But despite this, there were still immediate calls for tougher lockdown restrictions.
This news comes as a disappointment, but it doesn't in any way change the fundamental problem is that there is too much transmission of virus going on in the UK. There is no evidence that this virus, this variant, transmits in any different way than the previous variant. And I would argue that the current lockdown is insufficient to actually control this virus.
Another emerging danger, according to scientists today, is that other new variants across the world could be resistant to current vaccines, making questions around the UK's borders more pressing than ever. Other countries have taken much tougher measures, like Australia, where entry is refused except to residents and those with an exemption, and quarantine must take place in a state-approved facility, leading to scenes like this of the world's top tennis players being forced to prepare for the Australian Open in hotel rooms. And some MPs believe Britain must now up its game. Given the news of the new variant, does it make it more important to act quickly in securing the UK's borders?
It makes it much more important. We know that new variants are going to come along all the time. We know that there's been variants in the UK, we know there's been variants in South Africa, and probably in other countries around the world that we're not yet aware of. So making sure that we protect ourselves from these variants that could be more lethal or more contagious is essential to protecting the British people.
Today should have been about the success of the UK's vaccine rollout, but in the end it was overshadowed by the more deadly new variant and the devastating death rate. And all of this as the wider challenge to keep a pandemic-weary public locked down goes on.
Stay home, protect the NHS, save lives.
Just before we came on air, I spoke to Neil Ferguson, Professor in Epidemiology at Imperial College London and a member of the government's new and emerging respiratory virus threats advisory group, otherwise known as NERVTAG. I began by asking him to explain what he and other scientists have discovered.
All the groups which have been looking at this have detected a signal of an increased risk of death in people who test positive for the variant compared with the non-variant. The reason for the caution is that we only really know the outcome of infection, whether people get hospitalized or whether people die, in a minority of cases. And so of everybody who dies, we unfortunately from this virus, we know whether they got the variant or not in only about 8% of those cases. So we see a very clear signal in that sample of 8% of deaths, but we know very little about the remaining 92%.
But this is a high percentage increase, isn't it? 30 to 40% increase of mortality on a relatively small number.
Yes, for a 65-year-old or 60-year-old at the current time, there's about a 1 in 100 risk of dying. So that means 10 in 1,000 people who get the infection are likely to die despite improvements in treatment. And this new variant might take that up to 13 or 14 in 1,000.
So what does this mean for the measures that we're under? Does it mean that we need to increase the measures?
So with increased pressure on hospital services, we've seen an increase in mortality regardless of the new strain as well. So if we're in the position where hospitals are full, unfortunately clinical care inevitably suffers. And I think this just adds to the evidence suggesting that, the measures currently adopted are absolutely critical. Whether measures need to be intensified in the current situation remains to be seen. I think in the next week or two, we'll have a much clearer picture of what's going on, for instance, in the Midlands, where we're still seeing, let's say, flat case numbers and increasing hospital admissions. And certainly it adds to the evidence that we need to be very cautious about any early relaxation of the current lockdown.
So has this new strain effectively wiped out the medical advances in terms of keeping people alive in hospital that the doctors have developed over the last 9 months?
It certainly potentially reduced those advantages. What we've seen in this pandemic is from a peak when hospitals were really overwhelmed in London, principally in April of last year, and it was a completely new virus, 30% or more of patients hospitalized were dying. That has been actually brought down quite substantially, now to about half of that. It's gone up a little bit, as I said, in the last month, with hospitals being really quite overwhelmed again, to about 20%. But of course, an increase in the overall risk of severe disease, which we think is what might be going on with this new variant, does to some extent counter those gains. Not completely. We're still in a better position than we were back at last April, but it's still a worrying picture.
And do you have any explanation as to why it might be more lethal?
First of all, I'm not a virologist or immunologist, and I'm an epidemiologist. There are still some hints that maybe people have a higher level of virus in their bodies when they're infected, which might predispose to greater transmission and might also predispose to greater severity.
And you mentioned that the Brazilian and South African variants may be more troubling than this current British one. What do you think that means for the current measures that are in place and whether they need to be made more severe?
So I don't think they have immediate implications for the current measures, because there's certainly no hint that these new variants in South Africa and Brazil are more transmissible than what we already have. So as long as we can achieve control and start driving down case numbers across the country, and particularly numbers of hospitalizations and deaths across the country with the measures we have in place, those measures will probably be effective against any new variant as well. The more concerning thing is whether those new Brazilian and South African variants are less susceptible to vaccination. The vaccines we're deploying are less effective against them. It's unlikely that the vaccines will have no effectiveness, but again, the faster we can roll out vaccination, initially getting the first dose into people and then getting their second dose, the better position we'll be in.